Can you hear me? Can you hear me?
Yes, sir. Sir.
Okay, ask them to join first.
Okay, sir.
Can you hear me? Amma? Okay. Can you hear me?
Yes, sir.
Okay. Who is having the seminar now?
Sir, it's me, roll number 5.
Okay. 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 So, can you hear me, all of? Can you hear me properly? Rule number 5. Can you hear me?
Yes, sir.
Okay.
Yes, sir.
Okay. Okay. Is she audible to everyone? Rule number 5. Okay. Okay. So starting
Yes,
with
sir.
yeah.
It is audible.
Yeah. So starting with today's seminar. So she will be presenting one interesting topic called as hamburger disease. Yeah. Hamburger disease.
Okay.
I think it's related to E. coli. Hamburger disease is related to E. coli infection.
Yes, sir.
Okay. 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 So she'll be speaking about this particular disease. I think it will be very interesting for all of us. Okay. So I'll just share the screen. Okay. And okay. You just have to tell me when to send the slides, okay? Can you hear me? Everybody can see the slide? Can you just,
No, sir.
okay, 1 second. 1 second. Now, can you see the screen now?
No, sir. It's not visible. We can't see it.
Okay, 1 second. Huh?
No, sir. It's not visible.
Okay, okay. Is this okay now? Is this okay now? Is this okay now?
No, sir.
Okay.
No,
Now?
sir. The screen, we can't see the screen, like the slide or not.
No. Okay. 1 second. Can you hear me now? Can you hear me?
Yes, sir.
There are some issues, network issues at my end. Okay, so
Yes, sir.
there may be some problem. Okay, I'll just try to share the screen again. Now, can you see?
No, sir.
Okay, can you share from your side? Can you share from your side? If I make you host.
So you have to. Yeah, yes, sir. I can.
Okay, okay,
Like if you make me the host, then I
okay,
will be able to share the screen.
okay, okay, okay. I'll just make. Okay, done.
So can you see the screen?
Yeah, yeah, I can see. No problem.
Okay. So shall I start now?
Yeah, yeah, yeah. It's up to you only. Just start it.
Okay, sir. A very good morning to you, respected sir, and all my dear friends present. My name is Mebala Rishishadhar, and my topic is on hamburger disease. Now, the contents are introduction, history, symptoms, causes, lab diagnosis, treatment, precaution, conclusion, and last is the reference. Now, the introduction. Hamburger disease, it's a foodborne or a food poisoning disease which is caused by strain of E. coli bacteria called O157H7. Also, it is also known as a hemolytic uremic syndromes. It's a condition which occurs when the small blood vessels in our kidney they get damaged or inflamed, and when that happens, like there's formation of clot in the blood. So next, the history. Now, hamburger disease. It was like it was recognized for the first time in the year 1982 during an outbreak investigation of hemorrhagic colitis. It's linked to ground beef. Now, ground beef they are made up of only skeletal muscles, and this foodborne infection or disease. It's what to say. It's a very much linked with other foodborne disease, but it's account for only 33% out of 5,269 foodborne related cases. Next, we have the symptoms. Also, we have extreme fatigue or tiredness, shortness of breath, easy bruising, unusual bleeding, decreased urination, or sometimes blood may be found in the urine. Also, we have high blood pressure and swelling. In some people, especially in kids like children under the age of 10 and elderly people, they tend to get infected very easily with this infection. And when it leads to and it sometimes it may leads to a serious condition which is the hemolytic uremic syndromes. In here the RBCs they get damaged, and this in turn leads to kidney failure. Hemolytic uremic syndromes, they often occur after a gastrointestinal infection, including Shigella and Salmonella. Next, we have the causes. Now, the bacteria that cause this disease, they are found mainly in cattle. Also, like I have mentioned in the introduction part, it is caused by strain of E. coli called O157H7. Also, the main The main causes of this disease, it's like when a person drink or eat any contaminated food, like water that have been contaminated with feces of a person infected, or any animals. Also the most common cause of this disease is when we consume undercooked meat, or when we consume raw milk or unpasteurized milk. Also when we eat food that have been in contact with dirty surfaces. Touching When we touch pets or other or any other farm animals, if those animals they have that bacteria, then it's there's a high chance of uh a person getting infected with that. Also sometimes when we change the diaper of any infant infected with this bacteria and we don't wash our hands after that, then that also makes a person get infected with that disease. Next we have the lab diagnosis. In here, uh this infection, it's diagnosed by detecting bacterium in stool. Also, if any person feels like he or she is infected with this disease, or maybe that person have sudden bloody diarrhea, then it's a must for that person to go for laboratory tests for any specimen on sorbital mcconkey agar. McConkey agar, it's an agar used for detection of E. coli. It helps by raising the pH of a medium, and that in turn helps us in differentiating between non-pathogenic and pathogenic bacteria. Uh, Under the lab diagnosis, we have three types, that is the blood test, urine test, and the stool sample. Now, in the blood test, we can determine if the RBCs are damaged or not. Also, it helps us in revealing a low platelet count or low RBC count, or also it helps us in detecting the higher, if the citrulline level is higher than the normal or not. Now, creatinine, it's a waste product produced by the muscles, and it's usually removed by our kidney. The next one we have the urine test. Now, in this test, we can detect abnormal level of protein, blood, and also we can detect if there is any sign of this infection in our urine. Next one is the stool sample. This test help us to detect toxin producing E. coli and other bacteria that can cause this infection. Next, we have the treatment. Till date, like there's no specific therapy that have been proven to be effective for this infection, but most of the people who get infected uh, with this disease, they get better on their own in about 10 days. Also, patient infected with this disease, they are given plenty of fluid so that they can avoid dehydration. Also, like I have said, like antibiotics in most cases they do not have any benefit in treating this illness. Now, for patient with kidney failure, the treatment are dialysis, then blood transfusion to return the blood to normal. Also, they are given high blood pressure medicines and a special diet. Also, intravenous immunoglobulin may be given also. Next, we have the precaution. Now, the precaution are very simple and basic. It's mostly uh, in our day-to-day activities, uh, we should keep in mind when we are in the kitchen before cooking and after cooking, it's a must that we should clean our hands. Also use a separate chopping board for cutting raw meat and also vegetables. The vegetables and the meat should be cleaned properly and should be cooked properly. We should never consume undercooked meat because, as I have said, it's the main causes of this disease. Also, do not consume unpasteurized milk. If a child or any kid is infected, then exclusion of those kids from a daycare center, it's required until two negative stool culture are obtained. Then we should wash our hands frequently And also when we touch any pet or any animal that is sick, it's a must that we should put on gloves and wash our hands properly after after coming in contact with them. Also avoid direct contact with a person suffering from this infection. Next is, like, how can animals get this bacteria? Like animal, particularly those animals, those livestock animal, that live in land or water or any non-living object. Now the conclusion, for the conclusion, I would like to say, even though this disease, it's not so much not so many people know about it, but once we know about it, it's very important that we take preventive measures, because it's a very, what to say, it's a very dangerous disease, because it may also lead to death, coma, seizures, and also hemiparesis. Now seizure, it's a sudden uncontrolled electrical disturbance in the brain. And hemiparesis, it's a partial paralysis of a person, like one side of the body paralyzed, and also the muscle weakness. That's it. Thank you.
Okay. Can you hear me all? Can you hear me all?
Yes, sir.
Okay, yes. We are facing lots of network issues today. Okay, so I'll go through some of the questions. Okay, uh, can you
Yes,
just
sir.
tell me what actually hamburger disease? What happens?
Sir, it's basically a food-borne disease,
Okay,
which is the main cause of this is like when we consume undercooked meat. Then
okay,
from that also, because in that there's a lot of, what to say, E. coli bacteria that causes this disease. It's present. So, sir, we need to eat, what to say, we need to eat proper cooked food,
okay.
avoiding all the undercooked meat and all.
Okay, what happens here actually? If you are getting this disease, what are the symptoms you can see?
The symptoms, sir, like there are many symptoms. There is first though, it's diarrhea. We have we have diarrhea, and then pale coloring of the skin. Also we have bloody diarrhea. And if not treated properly, this may lead to kidney failure.
Okay,
Also sometimes it lead to death.
okay. Why there is kidney failure?
Sir,
Why there is kidney failure in this disease?
so like when the RBCs they get destroyed.
Okay, they got distracted.
Sir, in this disease, like when we, pardon, sir?
Because the RBC got distracted. You told RBC got
No, when
distracted.
they
What?
get destroyed, then
Okay, okay, okay. So there is
sir, I
damage in the
said,
small blood vessels. That is why you may have some kidney failure also. Okay,
yes, sir.
okay, okay, okay. So where can you find the first case of this disease?
Sir, first case,
Okay,
I know, maybe in, sir, Australia,
Australia.
because people mainly people died. I'm not sure, sir.
Okay, okay. And you are talking about some strain of E. coli. Which strain is responsible?
Sir, it's 015787.
Uh-huh. 015787. Okay,
Yes, sir.
okay. So, what are the that one treatment for this particular disease?
So like till date, there is no like a particular antibiotics or any therapy that can
Okay.
um, that can help in a patient to recover. But
Okay.
like the patients are given many sorts of fluid
Okay.
during this time.
Okay. Okay. Very good. Other, are you having any question? Other students, you can ask, sir, if you are having any problem, because it is related to your topic only, your subject only. Other students, are you having any question? Can ask, sir. Okay, I hope they are not having any question. Okay, so with this we come to the end of this particular session. Okay, so in the next class we will have for roll number I think 6 or 7. Okay.